Hi, and welcome to this week's video podcast. I'm Brent Dodge, owner of Alpine Physical Therapy. I have with me Angela Listug-Vap, a highly experienced physical therapist who is our clinic manager at our North Clinic. Angela's here to talk to us today about a unique topic that she's very familiar with on manual physical therapy. Angela, we're glad you're here.
Thank you.
You know, Angela, I hear a lot of patients that come in and they've heard about manual physical therapy. Can you help our listeners know what manual therapy is?
Sure. Manual therapy is basically the use of hands-on techniques to affect the body tissues, such as it might include massage techniques for muscles, it might include mobilization techniques for joints, and basically these techniques just help create either movement or relaxation or some improvement in tissues.
You know, I've been doing PT now for about 20 years, and I know there's a lot of therapy that goes on, and people really focus on exercise sometimes, but it seems to me that if a part isn't moving right, a joint isn't moving right, the muscles aren't working right around that joint, that if you don't do the manual therapy piece, the exercises aren't going to be optimal.
I find that to be true often. I probably use manual therapy and exercise equally in my practice. I use manual therapy often to reduce a pain because when there's the presence of pain, often that inhibits proper movement patterns. So if you don't get rid of or reduce pain, then you can't necessarily teach a good motor pattern with exercise. So I will often use manual therapy techniques to create relaxation in muscles or a little bit better movement in a joint so they can move through a range that's not as painful, and then I follow that up with exercise.
I think our viewers need to know a little bit about you, Angela. I mean, a lot of physical therapists would use manual therapy as part of their practice. What sets your work apart with your credentials and your background as a manual physical therapist?
Well, that's right. You know, most physical therapists that work in an outpatient setting that treat orthopedic conditions use manual therapy. But some of us, including myself and you, have had more advanced training in manual therapy. And that basically just means that we've gone through a structured program, so we've learned how to use techniques and the right techniques and a multiple variety of techniques to address this, specific problem in a really structured, proper way. You can pick a technique, and it might not be the right technique for that person in that moment in time. And so, advanced training basically will give you more structure in your clinical reasoning skills about when to use what technique. And for me, I've gone through a residency fellowship program down in the Bay Area that was about a year long, and it was an advanced manual orthopedic therapy. And then you have gone through a lot of the NIOMT courses, which is another outstanding program. But I really do encourage people to see if manual therapy is going to benefit your condition. I really do encourage people to seek out somebody that's had more advanced training in manual therapy.
Great. And I'm just wondering, in terms of your residency work, at one point we thought maybe 2% of physical therapists had actually gone through a program.
Yeah.
But what I hear now is there's a whole lot more interest and involvement with that. People are seeking that out more.
Yeah, which is great for our profession. I think it's about 3% of all physical therapists now attend some residency program. That doesn't mean that they're all manual therapy programs, but I think it's a great transition for a physical therapist coming out of an entry-level doctorate program to go into a residency program and really push their skills in a setting where you're forced to do your very best every single time, and you're working with patients and you're working with mentors, and it's an excellent experience to improve yourself as a clinician.
Angela, it's my understanding you're the only fellow of the American Academy of Orthopedic Manual Physical Therapists in the state of Montana.
I believe that to be true right now, but hopefully that's not always the case.
How would a person achieve that without going through a residency program like that?
You can't. So to become a fellow of the American Academy of Orthopedic Manual Physical Therapists, you do have to attend a residency program in manual therapy.
Amazing. And just for our viewership, I just want you to know that having Angela aboard Alpine has been an incredible opportunity for all of our physical therapists to gain greater understanding of manual physical therapy. The fact that Angela oversees our in-service instruction on a monthly basis, we're certainly benefiting from that as well. Angela, what are some conditions that a person might be experiencing that could benefit from manual physical therapy?
There's so many conditions, and if I just think about my patient population this week, I've used manual therapy when I've been treating the spine, low back, thoracic spine, cervical spine. I've used it for shoulder impingement. I've used it for knee osteoarthritis. I've used it for ankle osteoarthritis. You can use a lot of manual therapy techniques even for some instabilities like ankle instabilities.
Well, I know we see a lot of back patients, but we also see a lot of arthritic knees. Tell the viewership a little bit about your approach to manual therapy to a stiff arthritic knee.
So the way that I would use manual therapy techniques with a stiff arthritic knee is, usually during your evaluation with that type of presentation, you'll see that the knee doesn't fully extend. And so they're walking on a knee that's just slightly bent, which means you're putting abnormal stress on tissues that aren't really meant to take that kind of stress all the time. And so one of the things therapists often do is try to improve knee extension for pain-free walking. And so often I'll use an extension mobilization technique to improve that extension. So that's one example.
Now in the spine, we see a lot of back patients. What are some of the things that you do with a manual therapy approach for people with, for example, low back pain?
One of the most common techniques I'll use is just a lumbar rotation technique. So sometimes people will have, it's not uncommon to have discogenic problems, where you've had a problem with a lumbar disc, or even a problem where there's not enough space where the nerve roots come out of the vertebrae, the vertebral column. And so a lumbar rotation technique is a really nice way to kind of open up that space and give a little relief to the nerve root and discs, because of the direction of their fibers. They respond really nicely to a rotation stretch, which is what we're doing.
I don't even have back pain right now, but just you're describing that makes my back feel better. That is incredible. I wonder if some of our viewers may be wondering how to seek out a physical therapist who has some advanced training in manual therapy. How would they go about finding such a person?
Well, you could call us, Alpine Physical Therapy, because we have quite a few manual therapists on our staff. But if you really, if anywhere in the world, you could look up on the website of aaompt.org, and you can search Find a Fellow, and you can find a Fellow of the Academy right there. You can also look up, I don't know if this, I would actually probably call clinics to find out if they have a certified manual therapist on staff.
Idea.
Because I don't know any other place to actually search that information out.
Excellent. Well, really want to say a special thank you to Angela for being here and sharing some valuable information on manual physical therapy, and I'm sure you're anxious for the tip of the day.
One of our favorite self-mobilization or knee stretches for osteoarthritis is called the little girl swing. And you basically just sit on a surface where your feet don't touch the ground and your legs move very gently back and forth. Believe it or not, this makes your knees feel quite a bit better.
I'd like to say thanks again to Angela Listug-Vap for sharing information on manual physical therapy. For more information, be sure to hit the link on our website next to this video to the American Academy for more information on manual physical therapy.